Dear students, today we are going to study creams. Basically, semi-solid dosage form. It also consists of creams. Previously, we have studied ointments, which also belongs to the semi-solid dosage form, and creams. Basically, they also belong to semi-solid dosage form, and they contain either one or more than one drug substances or medicinal agents or active ingredient, which are dissolved dissolved or dispersed in the suitable base. And types of the bases which we have already studied, they are hydrophilic bases, hydrophobic bases, oleaginous bases, hydrocarbon bases. So these are the bases which are used for the formation of the creams. Creams are basically emulsions of oil and water type or water and oil type. And oil and water emulsions, they are basically microcrystalline dispersions of long chain fatty acids or alcohols that are water washable. Now, what are long chain fatty acids? Basically, oils with linoleic acid or alpha linolenic acid, which are used for the decrease of eczema formation, and linoleic acid, it is essential fatty acid which is incorporated into cell membrane, and it regenerates the damaged lipid barrier of epidermis, and it also prevents the water loss. And unsaturated fatty acids, what are they? They show prominent healing effect on skin inflammation, so they are used in cosmetics. Creams could also be defined as homogeneous mixtures or semi-solid preparations which consist of emulsion systems. As I have already told you, they are emulsions either oil and water or water and oil type. They are their consistency and their rheological properties. They depend on the type of the emulsion in which they are formed, and also on the nature of the solids in the internal phase. Now, what is rheological property? That is the flow response to the stress applied, or you can say the flow of the liquid, gas, or soft solids under the condition which respond with the plastic flow rather than deform the elasticity to the force. And they are also the term cream, it is also used to describe that they are soft cosmetically acceptable types of the preparations which are used on the skin. They have preservatives. They contain preservatives unless medicaments or bases have the bactericidal and fungicidal activity, which means that preservatives are also added in the formulation of creams to prevent the microbial attack or to prevent the microbial growth. And normally the preservatives which are used in the different pharmaceutical preparations are methylparaben and propylparaben. And some of the bases, they have bactericidal and fungicidal activity, which means they could destroy the bacteria and fungus. What are the different uses of creams? Creams, they are used as skin protectants, which means they will form a protective layer or coating on the skin when they are applied, and hence they will act as a protectant against the pollutants, against the environmental factors, against the irritants, or against the ultraviolet rays of the sun in case of the sunblock creams. And they will act as a physical barrier, and they will also act as a chemical barrier, as in the case of the sunscreens. They help in the moisture retentions, which means that they prevent the escape of moisture from skin, or they prevent the loss of the moisture from the skin. And the example of such type of creams are water and oil creams. And they have cleansing properties, and they have emollient effects, which means they are very soft. They will give a soothing effect, a softening effect to to the skin. And hence creams, they are used for the to prevent the dryness of the skin, itchy patchiness of the skin, and scaliness of the skin. So to remove the dryness of the skin, creams are used, and to make the skin more soft and soft and soothing creams are used. Now, the vehicles for the drugs, for example, these creams they could act as a vehicle for different drugs. For example, different drugs they could be incorporated into the creams for their particular effect. For example, as a local anesthetic, which means there are certain creams which will which will produce local anesthesia. They will numb the surface or the affected area on which they are applied, and there are certain creams which are used as for their anti-inflammatory effects, which means they will be used against the inflammation. And then we have NSAIDs. NSAIDs, these are the non-steroidal anti-inflammatory drugs, and they reduce the pain, reduce the fever, and prevent the blood clot. They are used against the inflammation, and but NSAIDs they have certain side effects, like they can produce ulcers and different other side effects. So we have the examples of NSAIDs are, they include ibuprofen, diclofenac, mefenamic acid. These are the examples. So basically these creams they are used as a vehicle or as a solvent for different drugs, like anesthetics, like anti-inflammatory drugs, like NSAIDs, like corticosteroids. Now corticosteroids basically, steroid hormone is secreted in the adrenal medulla, and corticosteroids is the type of the anti-inflammatory drug which is used for the rheumatoid arthritis and also for the inflammation of blood vessels, which is called as vasculitis. Now, different hormones, for example, hormones you already know, they are the regulatory substances which are produced in the body, and they are transported to the blood, and then they stimulate certain cells and tissues for the action. And examples of hormones also include insulin, estrogen, progesterone, testosterone, prolactin, and they different antibiotics. For example, antibiotics they inhibit or destroy the growth of microorganisms, and examples of antibiotics includes penicillins, cephalosporins, tetracyclines. And then we have antifungal drugs. Antifungal drugs they are used against different type of fungus, disease causing fungus. For example, meconazole, it is used for athlete foot, ringworm, and candidiasis. Ringworm basically, there is a fungus which eats keratin, and keratin is present in the hair, skin, and nails and scalp. Now, so this fungus it affects these particular parts of the body, and this infection is called as ringworm infection. And for its treatment, meconazole is used, which is an antifungal. Similarly, clotrimazole cream, it is also used for the athlete foot, ringworm, and candidiasis. And terbinafine cream, it is also used for athlete foot and ringworm infection. Now, the creams they dry the injured area. For example, if it is oozing, or if some type of secretion it is secreting, so it dries up that particular area. It also prevents any sort of irritation and inflammation, and the growth of microorganisms on the skin is also prevented. It prevents different infections in some sensitive organs, and it also prolongs the action at the injured site. It is creams they are used on skin and on different mucous membranes for different purposes, like a protective purpose, they will act as a protectant, and for the therapeutic, their therapeutic effect for the medicine effect that they will produce, and also for the prophylactic purpose, which means to for the prevention of the disease. And when especially when an occlusive effect is not required, which means that the occlusive means stopping or blocking, so the blocking effect is not required, then they are used. Now there are different types of creams. As I told you earlier, creams are emulsions, and there are oil and water creams and water and oil creams. So oil and water creams, they are prepared at high temperature, then they are cooled down at the normal temperature, and the internal phase it will solidify. And semi-solid form of water and oil creams, it depends on the external phase. It's correct on the characteristic of the external phase. Hydrophobic creams, they are also called as water and oil creams, and they are anhydrous. They will absorb a very small amount of water. They do not like water very much. You can say, or you can say that they do not have much affinity for water, and they contain water in oil emulsifiers like wool fat, sorbitan esters, and monoglycerides. Now, what is wool fat? It is a fatty substance from the sheep wool, which is used as ointment base, and it absorbs water. It is used as a protectant. It is used for the against the infection, irritation, and it seals the moisture. And you can wool fat is also called as a lanolin. Sorbitan esters, they are basically non-ionic surfactants which are used as emulsifiers in creams and ointments. And sorbitan esters, they are also called as spans. Monoglycerides, basically it is glycerol plus fatty acid via ester bond, they are formed, and the monoglycerides, they are present in bread, in baked products, in margarines. They all contain it, and monoglycerides, they are used as emulsifiers. Hydrophilic creams or oil and water creams, which means that the external phase is water, and they have a very high affinity for water, and they contain bases which are water miscible. Now they contain the oil and water emulsifiers like sodium or triethanol amine soaps. Now, triethanolamine, basically it is used to triethanolamine. Basically, it is an active ingredient which is present in the eardrops for earwax, and it is used as a pH balancer, and it is also used in certain creams and lotions. It is also used in eye gels and moisturizers. And triethanolamine, it is used to alkalize the long chain fatty acids, for example laurel, ricinoleic, oleic, and stearic acid, and it will form triethanol amine soap, which is soluble in water. Then we have other this triethanol amine. It is used. Then we have sulfated fatty alcohols. Now they are formed after sulfonation on fatty alcohols, and fatty alcohols, they are obtained from coconut oil, from castor oil, and from palm kernel oil, and they are used as emulsifying agents, as wetting agents, and as foaming agents. Now then we have polysorbates. Now polysorbates, what are they? It is a class of emulsifiers. This is basically an oily liquid which is derived from ethoxylated sorbitan, which is derived from sorbitol, and it is esterified with fatty acids. It acts as a surfactant, as an emulsifier, and as a fragrant. So these are used, and if it is required, water and oil emulsifying agents are also used. Now, what are the examples of water and oil emulsifiers? These are sorbitan steroids, polyglycerol oleate, lecithin, sorbitan, monoleate, and lanolin. Now these all are miscible with the skin secretions. Oil and water, basically it is composed of or it consists of, or it contains of small droplets of oil which are dispersed in the continuous phase, which is water in case of oil and water creams, emulsions of creams. These creams, they are comfortable, and they are very much cosmetically acceptable. Why? Because they are less greasy. They will not stain the clothes, they will not stain the dressing, so they are less greasy, and they are very easily removed if you wash the particular area or skin with, if you wash off with water. So they are easily removed or easily washed with water, or you can say they are water washable. Now emulsifiers, different emulsifiers of natural origins are used in it, in the formation of oil and water creams. For example, beeswax, wool's alcohol, wool fat. And what is beeswax? Beeswax or yellow wax, it is 100% natural wax which is produced in hives of honeybees, and it is esters of fatty acids and long chain alcohols. It is pale yellow, smooth in color. It has emollient properties, which means it will soften the skin. It has soothing properties, and it is used in different ointments and creams. Now, wool alcohol, it is the main component of the lanolin. Lanolin, I have already told you, wool fat or lanolin, these both are the similar things, or you can say it is the name of the, it is the two names of one thing. So, lanolin, it has three parts: wool alcohol, fatty alcohol, and fatty acid. So, wool alcohol, it is the main part of lanolin, and this is used as an emollient and in ointments and creams. And basically these the oil and water type of creams, they have emollient effect, and they are creamy, they are white in color or translucent, and they are stiff. An example is fluocinolone acetonide cream. So this fluocinolone acetonide cream, it is used for itching, redness, dryness, scaling, and it is used for the treatment of inflammation, psoriasis, and eczema, and it belongs to the class of the corticosteroids. Then we have example of hydrophilic ointment, which is oil and water type of emulsion ointment, cream, and it contains the formula is 25% white petrolatum, 25% sterile alcohol, and 12% propylene alcohol, and 12% propylene glycol, and sodium lauryl sulfate, and 37% of water. Now, this basically what the ingredients are. We have, as we have seen, it consists of white petrolatum and sterile alcohol, and propylene glycol, and sodium lauryl sulfate. This sterile alcohol, it is organic compound. It is saturated fatty alcohol, and it is used as an emulsion stabilizer, and it is used as a surfactant, emulsifier, and viscosity builder. Then we have a sodium lauryl sulfate. It is used in creams, lotions, and it is used as a surfactant, as an emulsifier, or it will solubilize the oil, or it will suspend the oil, and it is sodium lauryl sulfate is an anionic surfactant. Then we have aqueous creams. They basically contain the small droplets of water which are dispersed in the external phase, which is the oily phase, and they are very difficult to handle. And different drugs, they are incorporated into such creams, and they will be released more readily from a water and oil cream as compared to the oil and water cream. And what are their uses? They are moisturizing. They will keep the skin moisturized. They will act as an oily barrier, and they will prevent the loss of water from the outermost layer of the skin, and they will accommodate and release the lipophilic active pharmaceutical ingredients. And the example includes cold cream and moisturizing cream. Now, cold cream is water and oil type emulsion. It consists of white wax 12%, acetyl esters wax 12.5%, mineral oil 56%, and 0.5% of sodium borate, and 19% of water. So, white wax, it is used in ointments, creams, suppositories, and plasters. Basically, white wax, it is a mixture of beeswax and carnauba wax, and it is soft. It is creamy. Cetyl ester wax, it is a natural derivative ester of saturated fatty alcohols and fatty acids, and it is used in the production of over-the-counter products, and it thickens the emulsions, and it also acts as an emollient. Then we have cosmetic creams, and it includes all purpose creams which could be used simultaneously on different parts of body, like hands and feet, and all over the body. Then we have baby cream, which is meant to be used for the babies or infants. Then we have barrier creams and bleaching creams. Bleaching creams are meant to bleach the skin, to make the skin more fairer. Then we have cleansing creams, which is meant to clean the skin from the dust dust for removing of the dust particles or the pollutants or the environmental effects when one goes out to work, and when one reaches home, and back at the home, one has to use the cleansing cream to remove all of the dust and all of the external pollution effects from the skin. So cleansing cream is used, and similarly cleansing cream is also used to clean the makeup. And cold cream, they also belong to the cosmetic creams. Then there are certain hair creams which are used for the to make the hairs for the hair styling, and for maybe for the bleaching of the hair. And then they have hand creams which make the which make the hand soft. And similarly they have the vanishing creams which when used they vanish or disappear. Medicated creams, now there are different medicated creams, and we will study them one by one. First of all, we have hydrocortisone cream, and which is used for the rashes which are caused due to the poison oak or poison ivy, and which is used for the psoriasis and eczema. Poison oak or poison ivy, basically it is a plant which grows in the woody marshy area in North America. And this plant itself is not poisonous, and there is an oil in it which is a urushiol, and it basically, because of that oil, when the leaves are touched, the skin becomes itchy, and the blisters appear on the skin, and the rash is produced on the skin. But this hydrocortisone cream, it is used for the pain, for the rheumatoid arthritis, and for the swelling and itching skin. Psoriasis, I have already told you, it is a sort of skin disease, and on which the redness appears on the skin. And eczema, there is a dry scaly patch on the skin which is called eczema. Antibiotic creams, they are used for the treatment of small wounds or small abrasions, and for the treatment of different minor infections. And these small abrasions, they are caused when the skin is rubbed with the against the rough surface, and so the abrasion is caused on the skin. And then we have antifungal creams, which are used for the treatment of the ringworm infection, and then for the Candida trego or Candida diaper rash. Now, ringworm infection, basically, it is a contagious fungal infection by a parasite which lives on the skin and which eats the keratin. And as we know that our hair are made up of keratin, skin, nails, and scalp is made up of keratin. So this parasite, it constantly keeps on eating nails or skin, and so this infection is called a ringworm infection. And for its treatment, different antifungal creams are used, for example miconazole and clotrimazole. Now, then we have a Candida intertrigo. Basically it is a skin infection which is caused by Candida albicans, and it is caused between the folds of the skin. And for the treatment of this Candida intertrigo, fluconazole is used 100 to 200 milligram for 7 days. Then we have a zinc oxide cream, and which is used for the sunblock purpose, and for the diaper rash which is caused to different infants or babies by the constant use of the diapers. Then how these creams are prepared. Firstly, the preparation of oily phase is done, and powder ingredients, they are blended in the dry form, and then they are dispersed in the mineral oil or silicone oil. Now, silicone oil, it basically it is a sticky oil with organic sunscreen oils, and it is a polymerized siloxane with carbon side side chains, and it is used as a lubricant. And silicone oil, it is present in sunscreen. It decreases the it decreases the sticky oils, stickiness of the oils, which are present in the sunscreen oils. This is the and heating is required, and it with the help of the heat, the ingredients will be melted. And then hydration of the aqueous phase ingredients, emulsifiers, obviously these are the emulsifying agents, thickening agents and stabilizing agents. They would be dispersed in the water in a separate vessel, and heat will be required to increase the or accelerate the or fasten up the process of hydration. Forming of the emulsion, two phases are we blend, which is oil phase and water phase. They will be two phases will be blend, and they will be agitated and mixed to form a solution. Dispersion of the active ingredient, the active ingredient, it constitutes the very small portion of the formulation, and so it should be very effectively and efficiently dispersed to give the maximum effects, and to give the and in return the product on the whole will give the maximum effectivity to the patient. There are certain problems which will be encountered um, um, during the formulation or the preparation of creams, and those problems are, if the water is added when added to the water, these thickening agents, stabilizing and emulsifying agents, they are added to the water, agglomerates will be formed, which the blenders or agitators cannot break. They will not be broken by the agitators or the blenders. And in oil phase ingredients, ingredients, they form lumps, and hence the lumps, they will require the higher shear or more force to be dispersed. And ingredients are carefully hydrated, so to get the maximum viscosity and develop the yield. The partially hydrated materials, they stick up on the vessel wall or in the tank baffles, and and the parts of the agitators. Agitators, they cannot reduce the droplet size to form the stable emulsion. Then active ingredients, they could be temperature sensitive, the temperature, it should be monitored according to the active ingredients. Then cooling of the product, if it is done before adding the active ingredient, it increases the processing time. And the poor dispersion of active ingredients, it affects the product effectiveness. And long mixing times and additional equipments, they are required to obtain the homogeneous sort of product and a stable product. Now, method of preparations of creams, they include trituration method and other methods. So for the trituration method, the finely divided powders or particles or liquids, they are first finally the powders are finally divided first, and then the insoluble powders, they are added by the geometric dilution method. Now, geometric dilution method is the method in which the small amount of the drug, it is mixed with the large amount of the diluent, and in the end, the small amount of drug, it is mixed with the small amount of the diluent first, then it is triturated, then it is smoothed, and then the other quantity or other part or portion of the diluent is added, and in the similar way, the whole of the diluent is consumed. So in this way, the smooth paste would be, or a smooth mixture would be formed. Liquids will be added by making a well in the center, and the formation of the air bubbles, it must be avoided. And if you are preparing small quantities of creams, then glass slab, and the spatula, it will be effective, or it would be sufficient. But if you are going to prepare the large quantities of creams, then mortar and pestle would be used. Now, levication is another method, and in this method, the incorporation of insoluble coarse particles is done, or it is also called wet grinding. So the particle size over here is coarse. This coarse powder, it will be rubbed with the molten base. You have to take the base, you have to melt it, and then you have to add the coarse powder in it, or the liquid or a semi-solid base. Then obviously the force is applied for the mixing to avoid the grittiness and to produce a uniform cream. And hygiene conditions, they will also be kept under consideration. All of the area where you work, or all of the area of the manufacture, it should be hygienic, and there must be aseptic conditions. The equipments must be cleaned, and spatula, and every sort of equipment and spatula and instruments, they should be clean, and they are cleaned with 70% of ethanol. Then the miscibility of the substances, miscibility of substances incorporated, you have to check the substances which you are going to incorporate into the base, and you have to check the or determine the miscibility of those substances first, which you are going to incorporate in the base. Now you have to melt the fatty base, and the substances with the highest melting point, they are melted first. Then they are cooled to 60 degrees centigrade, and temperature of the aqueous phase, it would be adjusted to 60 degrees centigrade. And you have to disperse phase incorporated into the continuous phase at the same temperature. So the dispersed phase, it would be incorporated to the external phase or the continuous phase at the same temperature, and air bubbles should be avoided, and fast cooling or hasty or quick cooling, it should be avoided. Incorporation of solid ingredients into cream bases. Solid particles, they are incorporated into the bases after the bases cool down, and soluble solids, these are added to the cream at the lowest temperature, and then they are mixed until they are cooled. Insoluble solids, they are added by using the tile and spatula, or mortar and pestle, and using a doubling technique. Then the coarse powder, it is added, minimum amount of the cream, it is placed in the center of the tile, and then it is used to leviate the powders, which means the powders, they would be levigated with the cream. Fine powders, they are triturated into the finished creams on the ointment tile, and again you will use the geometric dilution methods. Then we have incorporation of liquids, different liquids, how to incorporate them in the bases or in the creams. There are non-volatile liquids which will not evaporate, they are miscible liquids. Now the method to mix them with the molten cream is and that and they are mixed with the cream in evaporating basin, and if a pre-prepared base is used, then you have to follow the procedure which we are going to study for the volatile and immiscible liquids. So coal tar, it is triturated with cream on a tile, and small amount of cream is placed on the tile, well is made and in the center, and small quantity of it will be folded slowly to avoid the splashing. Then we have diluted creams. They are the freshly prepared. No heating is involved, and they would be the dilution of the creams. It will be carried out in aseptic conditions, and they should not be used more than 2 weeks. What are the ingredients which are required for the preparation of a cream, or what are the components of a cream, or what are the excipients, and what are the active ingredients which are used in the formulation of cream. So active ingredients, this is the, as you know, it is the active pharmaceutical ingredient, that is the drug or any active ingredient which is used, drug or raw material which is used as an active ingredient. Base, it is the carrier of the drug, or it is used as a vehicle, or it is used as a, you can say, as a solvent, or you can say as a vehicle to incorporate the other ingredients into it. So preservatives, they obviously they are used to protect the drugs from the microbes, and hence they increase the stability of the product, and they prevent the drug from the microbial attacks, and they stop the growth of the microorganisms in the formulation or the product, and hence the product will have a long shelf life, and the product it will be intact during the storage until it is used by the patient, and even after the use by the patient, and during the use by the patient, it will be having the proper therapeutic value, and it will be stable. So preservatives are added like methylparaben, propylparaben, antioxidants. They prevent the oxidation of the drugs, which cause the degradation of the drug. So auto oxidation is there, and so to prevent this, antioxidants are added, and anti examples of antioxidants are ascorbic acid, vitamin C, vitamin E, which is tocopherols, and retinols, vitamin A, they are also added. Then we have surfactants. The surfactants are the agents which prevent the surface tension between the two immiscible phases. Like in the we have said that creams are emulsions, and emulsions have two phases: oil phase and water phase, and these two phases are immiscible. So the surfactants will be added to decrease the surface tension between the two liquid phases, or between the two immiscible phases, or between two liquids. And there are different types of surfactants, and ionic surfactants, cationic surfactants, non-ionic surfactants. So these are different classes of the surfactants which are used, and examples of surfactants are sodium lauryl sulfate. It is used as a surfactant. Sterile alcohol, it is used as a surfactant. So these are the surfactants which are used. Polysorbates, they are also used as a surfactants. So complexing agents, they increase the stability of the drug, and it prolongs the action of the drug. We are basically concerned with the stability of the drug, and I have already told you that drug should be stable. We are concerned with the physical stability, chemical stability, therapeutic effectivity of the drug, and we do not want the degradation of the our product, or degradation of the drug during the storage, and unless and until it is consumed by the patient. So these complexing agents, they will enhance the stability of the drug, and viscosity enhancers, they will improve the viscosity of the creams, and they will increase or enhance the viscosity of creams or ointments in which they are used. So, and humectants, these are the agents which absorb the moisture. So they will also help the drug. Containers for the creams, we know that there are how to pack these creams in, and what sort of containers should be used for these preparations, semi-solid preparations, which are we studying, which is creams. So the containers should be such that they should protect the product or the cream from heat, from the sunlight, from the high temperature, from the humidity, from different particulates. And the container should be non-reactive, which should not react with the product, and a container should be easy to use. It should be light in weight, so it could be carried by the patient easily in the purse, or during the traveling. It should be economical, it should not be very costly or very expensive, so it should be very affordable, both by the manufacturer, and then in return by the patient. And these usually containers which are used for the packaging of the creams are metallic collapsible tubes. These are the tubes which will collapse when the pressure will be applied to them, and then the product it will be released out. And plastic containers, they are also used, and we have also, you already know that the plastic, it has its own advantages. It is light in weight, it is easy to carry, it is inert, it is not reactive. So plastic containers are also used. And pressurized packages, they expel the product or the cream through the valve. These containers, they should be such that they should comply with the labeling requirements which we which have been mentioned for this particular product. And they should specify the expiry date on the on the container. And they should also specify the storage conditions, like like if it should say, the label should disclose that the creams, they should not they should be stored on a cool dark place. They should not be stored at high temperatures, or they should not be exposed to the sunlight, because some of the ingredients, they may be photosensitive. And then they should not be stored at a temperature which is greater than 25 degrees centigrade. And they should not be freezed, because the temperature, if it is in minus or it is very less, then it will also affect the stability of cream. Advantages of creams as a dosage form. There are certain advantages, like creams, they are water washable. Patient can easily wash them off with the water. These creams are easily to wipe away with the help of a tissue paper, or with the help of a piece of you can say cotton. And they are less greasy as compared to ointments. Ointments are more greasy. They will leave stains on the clothes, on the dresses, or on the dressing. So they are less greasy. And they are creams, they are very easy to spread, or very easy to apply on the skin. And they are suitable for the sensitive skin, which and dry skin and fair skin. They're also suitable for acute lesions, and they do not interfere with the skin functions. And evaporation of water from oil and water creams, it causes a cooling sensation on the skin. And they have a very low risk of the side effects. Now there are certain disadvantages of creams, and that are they are less hydrophobic. Mm, so the risk of contamination is high in creams. They are less viscous as compared to other semi-solid preparations. And a rancidification of oils, it also takes place. And the aqueous phase which is present in the creams, it is susceptible to the bacterial growth or mold growth. So preservatives are used to prevent this. And they have oil in a large amount, and some are inedible. So creams are not for internal use. It should be clearly mentioned on the label of the creams, that they should be used externally only. They are meant for the topical treatment, to be applied on the skin only, and they should not be taken internally. Any questions?